Good afternoon and welcome to the final session of CONVERGE 2021, hosted by the Technology Association of Georgia. We appreciate you joining for this session and hope you'll pick up a couple of ideas here to take with you and use it at your work. So this session's topic is integrating technology and well-being. How are we using technology to reach all communities? In particular, we'd like to delve into how can we use technology to not only reach communities, all communities, but also to help educate them about their well-being and to provide access to tools and solutions to improve their well-being. So good afternoon and welcome to the final session hosted by TAG. We appreciate you joining us for the session. And obviously I picked up a couple of notes there. Sorry about that. So my name is Chris Karabinos. I'll be your host and moderator for the session. And although my day job is as Vice President of Strategy and Growth for Telliant Systems, I also chair TAG's Digital Health Society, which concerns itself with the use of technology to improve the delivery of healthcare in the state of Georgia. I would like to ask our panelists to introduce themselves so that you know who you are listening to. Britt, would you introduce yourself?
Yes, thank you. I'm glad to be here. My name is Britt Amos, and I'm the SVP of HR for Global Technology and Product at Equifax.
Thank you very much. Dr. Tamara New.
Yes, thank you. Hi, my name is Dr. Tamara New. I'm a pediatric hematologist oncologist at Children's Healthcare of Atlanta, and I'm also the Aflac Director of Diversity, Equity, and Inclusion at Children's Healthcare of Atlanta.
Great. Okay. And Amy Apple.
Hello, good afternoon. My name is Amy Averill, and I am Senior Director of External Affairs for Comcast. And I have responsibility for our external affairs activities and corporate social responsibility in Georgia and South Carolina.
Excellent. Well, thank you all, and I'm looking forward to the conversation. So let's first acknowledge that people were stressed out before COVID, but we understand that life has gotten seriously more complicated since then, since March of 2020. We know that our personal well-being has suffered over the last 18 months, and we're all looking for relief and ideas to cope. Now, since TAG is a technology association, we want to look at how technology is or can be used to help in assisting with coping with and improving our well-being. This is not meant to be a program on COVID, but we've all seen how this technology has been used to help us and cope in unexpected ways. So we want to initiate this conversation by considering how technology is used in 4 areas that have an impact on well-being. That will include healthcare, mental wellness, eating, and exercise, if we can get to all those. For example, with the limitations imposed by COVID-19, telemedicine, which was a technology that's been around for years but used lightly, was given the opportunity to expand greatly, and it's made a huge impact, I think most of us can agree. So with that sort of as a setting, let me open up with the first question. And Tamara, I'm going to direct this towards you if you don't mind. So what are a few ways patients have benefited from the use of technology for their medical needs?
Yes, thank you, Chris. So I believe a lot of patients have benefited with, as you mentioned, the telehealth platform and being able to see their physicians, ask questions, perhaps hopefully go and get lab work if that's necessary, but not actually have to go into the healthcare facility if they're not able to. So it's allowed greater flexibility for patients that were a little bit nervous, especially at the during the surges of the pandemic.
Gotcha. Okay. Britt, how about you? Do you have an example?
So I think there's a lot of different apps that have recently come out that employers or you can just buy at the App Store that are helping communities. And what we see is it's taking sort of the friction out of the process, and it's really helping streamline so that people can get answers quickly, but also give them access real time to information, pricing. But we've also seen that in the space of mindfulness. And so at Equifax, we have downloaded some apps for our employees to help them with mindfulness, and it reminds them to take breaks and does, short, deep breathing exercises. And so we've really enjoyed leveraging those platforms to help our employees. And I think the broader community can as well.
Okay. So how do we expand the technology knowledge of disadvantaged or at-risk populations? So Tamara, do you have a perspective on this?
Well, I feel like it's important to make sure that people feel comfortable around technology, and so I think using other avenues is great, such as apps, because people oftentimes will have access to smartphones, and so are a little bit more comfortable adding an app to their phone and knowing that they don't have to learn, a lot of techniques in terms of how to get in touch or how to access some of these programs.
Do you find that is a challenging with some folks, with some people?
I definitely think it's challenging with some folks. A lot of my patients, I take care of pediatric patients, and so my patients had to quickly leverage from in-person learning to doing virtual school, which could be a challenge for some of them if they didn't have an area where they had great access, or if they didn't have the actual technology at home. And some of the schools may not have provided all of the resources that they needed for that. So being able to provide them a way that they could do telehealth visits, for example, where they could just use their phone, where they didn't have to have a laptop, I think was very comforting for some of my patients and families.
Interesting. Okay. And how about you, Amy? What's your perspective on that?
Well, one of the things that we've been doing is we, for years, long before COVID, had been partnering with a lot of community organizations, nonprofits, to improve or to provide digital skills training to low-income individuals of all ages, children, school-age children, up to seniors, veterans. Who might need assistance in developing these online skills, and who maybe just hadn't developed them previously because they didn't have access to the internet. So through our Internet Essentials program, and I think this is just broader for everyone, is just to try to get as many people connected with community organizations that can really get them comfortable with working online and really comfortable with some of the safety and security, privacy aspects of that, so that they feel more comfortable taking advantage of these opportunities.
Gotcha. And this is sort of off the path here, but realizing you work for Comcast and access to the internet is huge, especially for telemedicine. And I think about rural Georgia and the challenges that we have with internet access in some sparsely populated areas.
That's right. And so we are actively involved, as are many other providers across the state. I don't want to speak just for us, in trying to expand broadband access across the state. For example, in 2020, in the midst of the pandemic, we were able to launch a new area in West Georgia where we connected about 7,800 previously unserved homes and businesses with high-speed broadband. As some of the folks here may know, there is a lot of federal money coming down the pike. And in fact, just this week, applications were due for grants that are being administered by the state, but from the federal ARPA funds, to try to help bridge that gap to make these rural broadband construction projects make sense. So I know we have joined with some local communities in rural Georgia to try to bring broadband to unserved and underserved areas, as are a number of other providers across the state. So that's definitely a huge initiative for us, because all of this talk about telemedicine and these apps and whatever else there might be don't really help much if people are not connected to high-speed broadband.
Yeah, that's absolutely. You got to tackle the infrastructure first, among all the other issues we got to deal with. So, Britt, how do we educate people, and I include employees and the community, about new technologies?
So we actively, internally, I guess, are building out Google Sites and getting people engaged. We find in a lot of different social media platforms that video actually gets more hits. And so we've been trying to do short vignettes, but also podcasts. That seems to be better than just written language. And then externally, we, like other companies, are partnering with a lot of companies to do education. And so where we focus based on our purpose at Equifax is helping people live their financial best. So we target the financial literacy space. And so, we've just created the Spanish credit report to help people understand if they don't speak, if English isn't their first language. We also work with a bunch of partners in the area, but also broader United States, where we go in and teach lower income communities around credit and what that means and how you can improve your credit. And then we also have an app that's easily downloaded for the community where they can lock and unlock their credit report with just a swipe to help people combat fraud against their credit file. Great.
So Tamara, I don't know if you were expecting this, but just given the people that you work with, do you have any thoughts on how we can educate people in some of our communities about technology?
Can you repeat the question? I'm sorry, I didn't hear part of it.
Yeah, so how do we educate people, whether that's employees or a community, about new technology?
Yeah, I mean, I think, finding places that they're comfortable. So I think, letting their communities know, so their churches, their schools, their jobs, getting the information out to those places, I think, is one way to capture them. For a lot of my patients, the kids will pick up things sometimes sooner than the parents because they're in school and they're exposed to things and their friends are exposed to things. So sometimes that's a great way of interacting. We in the medical profession have tried to bring events to families and patients as well. So when we hear about things, we try to make sure that they're aware of what's available in their community. But there's also community organizations that may be targeted to particular groups of patients. I take care of patients primarily with sickle cell anemia, and so there is a sickle cell foundation here in Georgia. And so oftentimes they will distribute information to our patient population as well.
Oh, that's a great idea. So I know there's lots of nonprofits, churches among them, but lots of others that serve particular communities. And so if you could partner with them to get technology out, that can certainly play a role and also help make them more valuable to their constituencies. So I see that. Amy, have you seen technology used to reach more communities to improve health and well-being?
Well, I think just more broadly, we can talk about I mentioned, for example, our Internet Essentials program. I don't know if this is directly response to your question, but so one of the issues, in addition to the rural digital divide that we talked about, the access to broadband, affordability is a real issue as well, which we have recognized and for 10 years have been offering a low cost internet product to low-income individuals. Originally, it started with school-age children, but we have since expanded the program, as I mentioned before, to seniors, to veterans, to anyone really who's on any kind of federal assistance or federally funded assistance program. And so with that, we are trying to bring more people in to have access to the internet, even if they're already connected, even if there's already a line passing their house, that they can actually connect to the internet and be able to, do their schoolwork online, but access telemedicine, access these wellness websites and apps that Britt was talking about, and really take advantage of all of the opportunities that are available to them. And, that could go on to, workforce development, job applications, all the things that really play into our physical and mental well-being. So that I think that's really been our focus, certainly before COVID, during COVID, after COVID, is to make sure that we connect as many people as we can, either through the accessibility question or the affordability question.
Gotcha. Okay.
And I think, Chris, as we move forward, it seems like a lot of companies are taking the sort of native mobile approach, but I think it's important to continue to partner with companies that do mobile first, because I agree, or have a mobile strategy. And I think you guys all realize that's a different code base, but I agree with Tamara in that, a lot of people might not have the computer or internet at home, but I think a larger percentage of the population does have access to a smartphone. And so if you can provide those apps so that they can easily access it there and they don't necessarily have to be on the internet, I think that makes a huge difference for that population.
Excellent point. Yeah, by both of you. So yeah, appreciate you for emphasizing that. It's good. And I think a lot of technology, the company I work for is actually in the business of building software. And most applications you build today have a PC or a Mac-based piece of component as well as a mobile-based component. Because if you're building healthcare technology, even though the doctor may want on a computer and the nurse on an iPad as she goes in and out of rooms, the patient or the daughter of the patient wants it on a phone. So you actually have many form factors that intelligent software today is built on all three, but with the right information delivered to that particular audience in the right setting. So not every software is built that way, especially if it's 10 to 15 years old. It may just be on a desktop, but all the new stuff is being built that way. So that's an excellent point. So we got to present the information, technologically speaking, where the people are. Mm-hmm. The headline. So I want to ask sort of a A and a B question here, opposite sides of the coin. And I think once you hear the first question, you can understand what the other side of the coin is. But I'm looking for specific communities which have benefited, that you have seen have benefited from the use of technology in the area of wellness or healthcare. And we've already shared a couple of examples. But the flip side of that question is what communities have you seen that have not benefited from technology so far? So I'll go ahead and just let's look at the first one too. And if you have another example of a community in particular that's benefited from technology for wellness or healthcare, I'm just opening up to any of you.
Yeah, so I would definitely say that my patients and families have benefited. We have an app where they can see their electronic medical record. We give them apps for putting in their, or tell them information about apps to put in their medical information so that if they should find themselves in an emergency, someone's aware of what their underlying diagnosis is, what their allergies are very easily from their phone. And so a lot of my patients feel more empowered and are able to real-time see their lab results, test results, communicate with us, set up appointments that way. So I think that has really made a huge impact on our patient population.
Okay.
Yeah, and I feel the same for internal employees at Equifax, but also all of the consumers that we serve. I feel like technology has been a huge impact. And I think today we're talking about mobile apps and the access, but I think there's also a lot of good things going on in the industry in terms of bringing data together to be able to provide insights, to be able to drive faster decision making for consumers. So how can we get people access to credit quicker if they need a loan for a medical procedure or they need to get their first cars because they just got a new job? So I think we actively at Equifax are trying to bring all of that data together to make better decisions. And so, I think they say now that I guess data is king in this world. And so I think you see a lot of companies using technology to bring that data together and look at it differently. I can't think of a community that hasn't necessarily benefited, but I will say that if I talk to some communities outside of the United States, there's still challenges in some of the regions globally, just access to internet, but also the speed in which they get it. And so I know with working with some of my global teams in India and even in Latin America, that still can be a challenge. And even if it's in an app, they're just the connectivity and the infrastructure just doesn't look quite the same as it does in the United States.
And I would add to that, just that I have patient populations that don't speak English well. And so, they weren't born here. And so they have been slower to pick up some of the technology. So that has impacted that population of individuals.
Yeah, I think that's a good blind spot in the second part of that question. What groups or communities have not benefited? And, we're inventing a lot of cool technology here in the United States, but it isn't English-based. Maybe we go to Spanish in a second. But if you're beyond that, and I live in DeKalb County here in Atlanta, we got a lot of different languages here. And
Yes.
so there are a lot of folks who won't be able to use one of those unless they have an interpreter. So,
So I was just going to jump in back, to the training and awareness issue on that front. I can't speak to the, creation of the apps or the creation of the material, but I know that we're partnering. Some of those community organizations that we're partnering with to try to develop these skills are the Latin American Association, the Center for Pan-Asian Community Services, and other organizations like that to, again, reach some of those communities and make sure that they're getting access to the internet, access to low cost computers, and also that digital skills training. And again, maybe some more comfort with the information that they're finding online and with that.
can any of you think of any other groups or communities or populations that maybe, I won't say have been deprived, but don't enjoy the full benefit of technology today? And you talked about rural population, maybe income.
Yeah, I think, again, from my perspective, which may be somewhat myopic, I mean, we're trying to focus on those two prongs, is getting the access and then getting the affordability, and trying to bridge the gap that way.
All right. I just sense in the back of my mind that there are other groups out there, and I'm not out there enough. Nobody is everywhere, right? But it's interesting. Forums like this, things will pop up sometimes, and we'll discover, oh, there's a community over there that we're sort of out of sight, out of mind. We need to focus on it. Okay. Have you seen any good examples of technology being used to educate people about their health? Let me open that up. Have you seen any good examples of technology being used to educate people about their health or well-being?
So I think that actually, Chris, going back to your question, but I think I can bridge it to the question that you just asked. I was just thinking when you were talking about maybe an underserved community, I think about my parents' generation, and they didn't grow up with technology. And so like when my dad's trying to navigate something, a lot of times it's not something that they grew up with. It's not nascent. So they just, like the support. So he's always calling me saying, how do I do this? How do I download this app? And so maybe there's an opportunity for that like baby boomer plus group that did not grow up with a smartphone, and how do we educate them and teach them to be able to use the resources that have been created today. Maybe that's somewhere where we could focus. And I think that goes back to like your question around just education and how do we help and think about training differently for all of the different groups.
Yeah, I agree. Oh, sorry, Chris.
Yeah, go ahead, Amy.
I was just going to say, and this is maybe almost going back a little bit to the first prong of the last question, but seniors, we didn't really talk we've been talking a little bit more about specific health and telehealth activities, but, I feel like seniors are a group that really did and could benefit more from the technology because they've been, everybody's been isolated, but I feel like the senior population has arguably been more isolated, and they may have been social distancing a little bit more diligently than some other people. And just by nature of their circumstances, just may have been even more isolated before. So the technology to even just stay connected to people, stay connected to friends and family, stay connected to their doctors or whoever it may be, really, I think is a benefit to that population. But there is that knowledge gap, and we need to continue to work to make sure that they're comfortable with that.
Good point. And I think typically the first apps built are targeted towards 25 to 40-year-old people. And so those are the ones who are, because that's where the money is, right? And then eventually say, well, let's build them for 50-somethings, and then we'll get to the 70-somethings. Now, there are companies today that are building their entire business model based on solving problems for, retirement age people and beyond. So that's a big enough market now, and people are going after it. So that's another good example. So we've got seniors, we've got economic challenge, we've got rural, we got non-English speaking. Yeah, we're identifying a lot of communities there. That's good. Okay. What mental health technology products have you seen that are making a difference?
So I can't remember if it was Britt or Amy that mentioned the mindfulness moments, but I think there's a lot of different great apps that about mindfulness that have been really helpful. I think for individuals to just remind them, to take a break. That life is stressful. To exercise, to get enough rest. So those types of apps I think have been very helpful for the overall mental health of patients and families.
I agree with that. And there's a lot of different ones out there that you can partner with. I think the other thing that we've done using technology is using technology to create almost support groups or groups that compete. And so we have some really great platforms where you can connect in and ask people to join a running group or a Peloton group that just really, I think, gives people that extra motivation. And then they can, like, if you go and run a couple miles and you report it, you can high five the person that they, did their exercising today. And we also do some of that around food. So I think there's some great technology that's not complicated, right? And it's not an app that you have to buy, where you can get some good momentum on bringing people together in a community towards a common goal of exercise or eating well.
Gotcha. Any other thoughts on mental health apps?
I have a watch that tells me I'm supposed to get up for 10 minutes every hour, but I still somehow manage to ignore it.
There's also some, I think, that tell you how to take deep, to stop and take deep breaths, and to kind of just,
The problem is you have to actually pay attention to
Yes.
it. Yeah, exactly.
You have to not silence it over and over. Yes.
If you're on 10-hour Zoom calls a day, it's hard to interrupt yourself and go do that. I look up from the computer every 20 minutes, like you're supposed to, which I never do.
That's right.
Right. Are there any apps that you're aware of that help people eat better, eat healthier?
We have a big push here for the Weight Watcher app. That seems to be the one that people like. And there's a really strong supportive community through Weight Watcher. So whenever we've done anything around the eating, that's typically the one that we use.
Okay. Any others?
I know people who have used Noom. I have not used it, but I'll have to report back. I actually have a friend who just started it, and she was
UME or KNUME?
No, NOOM. They've been advertising for a while, and I think it supposedly has some kind of like psychological component to it, and there's support. I think you can sign up for a cheerleader basically to check in on you periodically, but I can't speak from experience.
I have a friend that's done it recently as well, and she liked some of the psychological approaches of just how people approach food, and then looks at things like she told me about exercise, sleep. So not just what you're eating, but also how much sleep you're getting, whether or not you're exercising or even just moving. So increasing your movement and things too.
Gotcha. So, Amy, you already mentioned, I mentioned rural healthcare. You're talking about, Comcast and some other things that you and others are doing to help expand access to bandwidth. What other ways do you see that those in government healthcare, actually, the government healthcare or technology can do to improve access to care using technology? In addition to bandwidth and creating more appropriate apps.
What can go, well, I think that from what I understand, and this is, I will go ahead and say right now, this is not my area of expertise, but, from what I understand, just through the COVID pandemic, I think what that did, it obviously amplified and underscored a need that was there before, to make telehealth and care like that more accessible. And my understanding, and Tamara can certainly jump in and correct me if I'm wrong, I think that just over the course of this last 2 years, the policy behind the use of those types of technologies has really changed, which is great.
Yes.
So for example, my understanding was before COVID, you could do telehealth in a rural area, but you still had to go to a medical facility and then connect with another medical facility in a more urban area with a specialist or whoever it might be. As a result of COVID and everybody in the world changing so suddenly, there was a policy change at the federal level, and then I think at the state level, to allow people to actually do that from home, to allow both the patient and the health and the medical professional to be at home and have those conversations. And I think there were some nuances with respect to whether or not it had to be video or could be audio in some cases, which I think was also a change. So I think there's also the question about pay parity, which I think has evolved somewhat over the last few years, but also is probably sped up with respect to COVID, which is that insurance and Medicare in particular, I think, reimburse the same for telehealth as they would for an in-person visit. And so, from a policy perspective, I think that's really where the government's come in to kind of make this a little more accessible for everyone to be able to take advantage of it.
Tamara, did you want to add to that?
Yes, no, I would definitely say that being able to have the flexibility of patients to be able to do telehealth from home was a huge success. Some of my families that were very nervous about coming to the hospital had multiple children and didn't have childcare now. So they couldn't leave the other children at home. It gave them an ability to be able to have the child that needed to be seen, which was huge. And also the flexibility for providers that where their offices might be partially shut down, or they were trying to limit how many providers were in the office, giving them the option to do telehealth from either their home or office also opened up greater opportunities. So I think it was a great move that we were very pleased to see happen.
Yeah, my concern, and I've followed this legislation you're talking about, Tamara. There are forces, I don't mean to suggest evil forces, but some people benefited from that. Some companies didn't benefit from that. And so the people that didn't benefit from that, they're pushing back and have been for about a year at the federal level, trying to close those regulatory changes. So it's not that people were averse to using technology. Once they tried it, they said, I like this. And Amy, one of the key points you said is once they decided to pay the same for a telemedicine visit as an in-person visit, the doctors were down for it and hospitals were down for it. Once it was a financial issue at the end of the day. And so if they close that loophole, then all of a sudden you're going to see doctors not getting on telemedicine consults anymore. So hopefully they can keep that in place. I know there's a battle going on in DC for that. And if they can keep some aspects of that open, because consumers want it.
Yes, yeah.
So it's never been a consumer fear issue.
Right. And I would say, I'd add to that, I have some families and patients that come 3 hours to be seen. And so if I can save them a visit every so often, and most of my patients we see every 2 to 3 months. So if I can alternate, doing a telehealth with an in-person visit and save them that 2 to 3 hour drive, then I think it's a win-win for both of us.
Well, I think you guys may be familiar with this, but there's something like 25 or 27 counties in South Georgia that don't have a hospital.
Yeah.
And so the hospital is primary care for half the people in the state anyway, and this is nationwide. It's not just Georgia. And so if people don't have a doctor, they go to the emergency room just to get the COVID looked at or whatever. And you don't have a hospital in these 25 counties. Where do you go for your primary care? And you can't get a taxi because you don't make enough money to go to the next county to go to a hospital or a doctor. So telemedicine is a lifesaver for a lot of people, and not just rural Georgia, rural America. So I really hope they can figure out some way to make that, keep that line open. Listen, I know we just got about 4 minutes left here. What I'd like to do is ask a closing question of each of you. And it's sort of an open generic thing, but do you have any suggestions about how companies or government can use technology to improve people's well-being? Do you have any suggestions for the audience?
I think it really starts with either the companies or the government listening to what consumers need and really getting the voice of the customer. You know, at Equifax, we like to say that we're product mindset led. And so what that really means is that we're actively trying to listen to what are the issues instead of us trying to just think, okay, we know what the consumer or the community wants, and actually going out and asking them, like, where do you struggle and where would there be benefits that we could use in technology to help us. And I think sometimes it seems so easy, but I think a lot of times we forget. And as organizations, we just go out there and we think we know, and we start building apps and technology, and we realize that that's not exactly what the community or the consumer actually needed.
That's a good point. Tamara?
I would agree. You have to ask the consumer. And so for me, that's the patients and families, asking them what they would want. Because I can think of things they may want, but I think it's important to know what would make life easier for them to stay on track with their medical care and their overall health.
User-based research.
Yes. Yeah.
Well, I'm just going to sound like I'm ringing the same bell, but I think that the investment that state and federal and local governments are making in partnering with providers like us to help expand the availability of broadband to people who do not currently have it is really important. And I think that we're going to see great strides. I mean, we've made great strides in the last several years, and I think we're going to continue to see that. I think that, we've also had great success in partnering with not only these local nonprofit community organizations, but also with local governments and local school boards to help connect people to the Internet Essentials program to get them, again, where there is a line going in front of your house, but you still can't or feel like you can't afford internet. We've been partnering with those schools and local governments to get the word out, make sure they know this is available to them, make sure that it includes the ability to get a low-cost computer, and then also the digital skills training. So we're just thrilled to be part of the conversation and to be part of the finding a solution to these issues.
Excellent. So let me have a couple closing comments here, Cameron, before you shut us off. First off, thank to all three of you guys. This is a wonderful conversation. I'd like to continue this if we had more time, but thank you for making time for this. I'd like to let everybody know that Digital Health Society is having an event next week on November 9th at Atlanta Technology Village. It's on Piedmont Road in Buckhead. And we're partnering with the FinTech Society. And the topic is emerging financial trends in healthcare. And I guarantee you the topic we talked about today will be on there. 2022 calendar plan already. We're going to have 7 events next year. The first one's Digital Health Day at the Capitol. That's where we advocate for rural access to bandwidth. That's one of the things that we will beat that drum, if you will. And that'll be in mid-February.